me to be one of the speakers. Okay. So for today, I will be discussing addressing mental health concerns during the COVID-19 pandemic. And for this particular lecture, we will be following this outline. It's basically a simple one because what I wanted to highlight is that all of us can actually have our own part in terms of promoting psychosocial well-being. So we will start with how COVID-19, just a review, and its impact on mental health, no? How we can liken to what is happening now in terms of the phases of disaster and the psychological reactions associated with the phases, and then how we move on to adjusting to the new normal and promoting psychosocial well-being. Okay, just a review, no? Remember that it was initially during December 31, 2019, no, when China alerted the WHO that there have been unusual pneumonia in Wuhan, but at the time, no, the virus was unknown, and it was actually January 7 when officials by January 13, okay, the WHO reported the first case in Thailand, okay, the first one that's it outside of Wuhan, okay? And of course, no, as you know, it slowly spread, no, in other parts of the world, okay, including Russia, Spain, Sweden, and the United Kingdom. But it was in our country, in the Philippines, that the first death outside China was declared in February 2. Okay, fast forward, no, in March, when eventually the World Health Organization declared that the coronavirus outbreak is considered a pandemic. 1 year ago, by April 2020, half of the world's population was under some form of a lockdown. Okay? And that by December 8th, the first COVID-19 jab was actually administered in United Kingdom. So you have to notice how fast, no, the things are actually moving around, no. But for us, no, who has been here and actually going through this, no, it really is kind of slow for the rest of us, no. As of April 2021, 16 vaccines are already authorized by at least one national regulatory authority for public use. And as of May 18, there are already 1.53 billion doses of COVID-19 vaccine that was administered worldwide. I hope that some of you has already the vaccine. Okay, but what happens in terms of the psychosocial impact of the pandemic? There's a profound and wide range of psychosocial impact on people at the individual, the community, and even in the international levels during infections like this. At the individual level, there is a fear of falling sick, a worry over loved ones, and a feeling of helplessness and stigma. On the community level, of course, there are closure of school and offices, quarantine, and the public safety concerns that compound our negative emotions. And in the international community, there are border closures, overseas workers, and stranded passengers were significantly affected. But in previous studies during the epidemics, for example, in the US influenza outbreak in the 1918, 10 to 30% has expressed very or fairly worried about the possibility of contracting the virus. And in the SARS outbreak in 2002 to 2004, there are significant psychiatric morbidities in non-infected population associated usually with younger age group. Therefore, during any epidemic, the population psychological reactions play a role in shaping both the spread of the disease and the occurrence of emotional distress and social disorder during and even after the outbreak. Okay? And as such, the current pandemic has caused changes for our mental resilience. No? We were challenged, imposing irreversible psychological impact on human society. Okay, through the following, okay, quarantine and commuting restrictions, no. In fact, no, for the Filipinos, we remain to be in quarantine even up to this time. No, concerns about work and the economic impact of quarantine, the fear of acquiring the disease, it has always been there, no, and doesn't stop. Depression and anxiety about losing loved ones, uncertainties about government work and school policies. No, before, no, they say that we will be opening schools especially for medicine, just like where I am teaching, but now, no, we were again, no, advised that we will not be resuming. So every time there are several changes along the way. Of course, together with that, the information overload is also very stressful, and of course, hearing about increased death rate, no, seeing your social media, your Facebook account as if it were an obituary all most of the time, no, really causes significant distress. As such, psychological reactions in pandemics may include maladaptive behaviors, emotional distress, and defensive responses. Therefore, psychological needs should never be overlooked during any phase of the pandemic management. Okay? How did it affect all of us? Okay, we had to quickly make adjustments to protect ourselves, our loved ones, and the community in which we live. The COVID-19 virus was no longer an international issue. In our own homes, it became a domestic crisis, bringing with it a surge of fear, doubt, panic, and anxiety. No? If you will recall, at the time when it was first announced that there will be a lockdown, no, we were scared, no, because we really did not have any experience about the quarantine. No, and we were all unprepared. Okay, we were all taken aback with this particular situation. However, no, they say that a pandemic like what we've experienced can also be likened to a disaster. Okay, because in disasters, okay, for every phase of that particular disaster response, there is corresponding psychological reaction. And what we want to highlight in this particular situation is that our reactions are not necessarily abnormal. They are not necessarily um, pathological reactions, but they are actually normal reactions in abnormal situations. Okay, because we say that a disaster is not a normal situation that we usually come across with. Okay, let's try to situate what is happening, no, in a pre-disaster time. No, for example, we seem to be aware, we have been hearing it, no, that there is a virus, no, we have to try to be strict to evaluate those who are coming into the airports, no, but at that time, no, there might be some fear, no, but we still went on with our lives. That is why at the time our emotional reactions are not very intense until such time, no, that we have heard that we have a case, no, and that at that time when we have heard that the cases, no, are beginning to increase, okay, that they begin to happen, no, in our own country. Did you notice how there was a heroic phase wherein a lot of donations, you remember that, a lot of clamor, no, for people to actually take care of our medical workers, no, to give them the necessary PPEs that they actually need, no. So at the time, no, it was a very emotional laden situation because we are all alarmed, no, and we want to actually reach out. Therefore there is an outpouring of support, no, and that peak comes out in the honeymoon phase. Okay, when we say the honeymoon phase, this time things are quite rosy, no. That is why community cohesion still continues, no. You still have an outpour of donations because we wanted to take care of the people around us, no. And notice that during this time, no, the medical workers, no, will have a sense of relief that they are actually being taken care of, no? However, the honeymoon phase does not last very long because after that, the reality of the situation sets in. Okay? That is the reason why disillusionment can actually start to creep in. When you have disillusionment, it means that the needs have actually gone high, no, and yet the support is no longer there, no. We now hear about the unemployment rates rising. We hear a lot of people being hospitalized. We hear a lot of people who are actually waiting in line to be admitted in the COVID wards. That is when disillusionment has set in. No, we become very sad. We become very anxious. No, and sometimes there is a strong frustration over how, no, our country or the government is actually doing its job, no. However, with time, no, once you have reached the point, no, of disillusionment, hopefully in time, by 1 to 3 years, no, we are slowly working through the grief and then slowly moving on to a reconstruction or a new beginning. However, note that these timelines are not very strict because if you notice, especially in a pandemic, they tend to fluctuate. For example, just when we thought that the COVID rates are going down, we suddenly have another surge. Okay, such that, no, when you have calls, no, that there will be another lockdown again, there will be certain heroic measures. That is the reason why, if you notice, we have encountered again another honeymoon phase, which is when the community pantries started to rise. Okay. However, once the cases go down again, no, again the disillusionment can set in for others, no. Those who have went ahead of us, no, they have already experienced trigger events and the anniversary reactions. Anniversary reactions are times wherein when you celebrate, no, one's death, no, they tend to actually elicit, okay, greater emotions from the people who have lost their loved ones. And for every stage, we also have varying approaches in terms of how we need to handle situations like this, such that in the pre-disaster phase, it's very important that we prepare, we establish trusting relationships, we evaluate planning and preparation efforts, and we educate the people. That is why you have to educate how to do preventive measures, hand washing, the purpose of using the mask, no. Those were pre-disaster phase efforts, no? And then when we moved on to the acute phase, the first priority is to ensure safety. That is why, if you notice, when you ensure the safety, when you ensure that the workers are well fed, well provided for in terms of their PPE, they actually don't burn out easily. Okay, because when their safety needs are met, then we say, no, that we have allayed their anxiety and fear. Okay, of course, we wanted to diminish the suffering of the people. We preserve the function of those who are working, and we promote resilience. That is the reason why last year, no, you have been hearing a lot of seminars about enhancing resilience left and right. Okay, but we are now into the post-acute phase. It has been a year since the time the pandemic has started, and this time around, we are trying to regain a sense of mastery and control, and we resume roles and activities and develop new normal routine. Okay, that is the reason why 1 year into the lockdown, no, have you developed your new normal? In a crisis, young people need most attention but get the least because the adults are actually busy dealing with the crisis at the moment and their own particular stresses. No? So what happens? Okay, I had a good journal, and I wanted to highlight this particular study, no, because this particular study takes note of how parental stress can actually be affected. Okay, During the pandemic, 46% of parents with children under 18 said that their stress level was high, and this was significantly high compared with 28% of adults without children. And of this 46%, they say that 70% of those who are stressed reported significant stress about meeting basic needs such as housing and food. And we can say that this is also the result of needing to care for their children 24/7, aid in their online education and homework while attempting to fulfill job responsibilities. Therefore, among the hard-hit population are those adults, who are responsible in the care of another individual or the parents. Okay, such that we always remind you that adults need to be mindful of their own emotional state. Why? Because in this particular study, okay, it was a study done sometime in April 2020 in Italy, and this study measures the impact of parental stress in terms of the dyadic interaction between a parent and a child. Okay, so for this particular study, they explored the effect of the risk factors associated with COVID-19 outbreak experience on parents and children's well-being. So how did they do the survey? It's an online survey of parents age between with children age 2 and 14 years old. If they have several children, they were asked to actually just rate one child. Okay, and they were measured based on their COVID contact risk index, home environment risk index, and the quarantine parent risk index. These ones are the measures that they use in terms of how stressful the pandemic has been with them. Together with that, they also tested for parents' dyadic parenting stress. It is measured by a 15-item parent-child dysfunctional interaction domain of the parent stress index short form. The parent's individual stress was also measured by the subscale of depression anxiety stress scale. And in terms of the children's psychological problem, the parents were asked to answer the parent report form of strengths and difficulties questionnaire. And this particular questionnaire focused on emotional symptoms, hyperactivity, inattention, and conduct problems. Okay, so they were able to have 854 participants, and 93% of these are women, and the children's mean age was 7.14. And what did they find out? There is no relevant association of COVID contact risk index, home environment risk index with dyadic parenting stress, parents' individual stress, and children's psychological problems. In other words, this situation did not significantly affect. But what happens? Okay, it is the parents' individual perception of the situation, specifically how difficult they find it dealing with the many stresses the quarantine imposes, that is significantly associated with parent stress and children's psychological problems. Okay, in other words, parents who are stressed tends to have impact on their children's behavioral and emotional problems through the mediating role of parent stress. Therefore, the higher the stress of the parent, okay, the higher the chances that they will see behavioral problems in their children. Okay? So, in this particular study, parents who are more stressed are those who, number one, have difficulty taking care of their children's learning. Number two, have limited space and time for themselves, the partner, and the children. And number three, have difficulty looking for activities they used to do before the lockdown. And the stress is experienced both at the individual level and at the level of the mother or the parent-child interaction. Okay? What are possible causes of it? Okay, what happens? Okay, number one, no, when parents are more stressed, they find it more difficult to understand their child's needs and respond in a sensitive way. Okay, as such, children from these families may feel less understood by their parents and tend to react in a more negative and aggressive way. Okay, and then the cycle continues, of course, because the child becomes more difficult, no, the stress of the parent again increases, so the vicious cycle continues, no. More stressed parents may also be too overwhelmed by the situation to find appropriate ways to be a supportive figure for their children and to find the best ways to address children's questions and fears, no, because when you deal with a child, no, they may have a lot of questions in their mind, no, and as a parent, we're supposed to answer them as patiently as possible. Okay? Unfortunately, if you are stressed, no, you will have a difficult time, no, answering to the best of your abilities, no, the questions that your children poses. Not only that, no, but parents are also left alone dealing with their children's education and learning, and this can be a very challenging duty for some of the parents. Okay? Therefore, creating a burden, no, for the parents. But they say that life goes on, we have to move on. So how then do we adjust to the new normal? Okay? What is the aftermath? No? Today's new normal is more than a remote work site. No? We are not working on site. Most of us are not doing that. No? We have virtual happy hours. No? How many times have you called your friends and then you attempted to watch together, or for example drink together, no? And in social distancing in public. But the new normal is also a constant state of anxiety, uncertainty, and stress that impact everyone's mental health in different ways. Okay? Therefore, adjusting to the new normal, no, will be quite difficult and challenging because during infectious outbreaks, the increased levels of stress and anxiety without usual coping mechanisms of the routine and social connectedness on hand are difficult. No? This is a period of collective uncertainty which results in the inability for everyone to be comforted. But we need to create a new normal because it can help reduce the anxiety that we have. Why do we need a new normal? Because we need to establish new routines and predictions based on our current circumstances. Because they say that the antidote to anxiety is a predictable routine, structure, and consistency. It is important for people to do what they know how to do. Okay? Therefore, on a personal level, no, for each of us, no, how do we do it? No, we can follow the crumbs method. No, C is for connections. Reach out to friends and family for support. No, as much as possible. No, try to be more active and do not wait for them to reach out to you. No, let us do our part in making that connection. Establish a routine because creating a daily schedule with realistic goals and actually assess your work-life balance. No? Try to have understanding. What do you need to understand? You have to realize how uncertainty and disruptions in your life increase stress. No? So if you are the type, no, who tends to plan your life, no, then you probably have to give yourself some time, no, to make regular calibrations or readjustments of your plans. No, we want you to also be mindful. No, stay in the present moment, enjoy the present without trying to predict the far future. No, we always say we don't know what will happen tomorrow. No, we don't know what will happen in the coming years. No, therefore let's try to enjoy the present, okay, by being by being in every activity that we do. Of course, we have to learn to set boundaries and limitations, no, for either negative thoughts, no, or even the information overload that we get from social media. No? But most importantly, let me highlight, no, especially for parents, no, or anybody who is in charge of taking care of somebody's concerns or a younger person's concern, please do not forget to practice self-care. Okay? Self-care should be a conscious effort to include activities that promote health, especially sleep, exercise, and eating well. Okay? Because self-care, no, it is an investment that should be done for all of us. No? Investing in self-care is a very important thing to do, especially at this time. Okay? But more than that, no, we don't want to say, no, we don't want to highlight that that these reactions that we are feeling are bad. No? Rather, we say that they are means to actually, there are means to actually help, no, promote psychosocial well-being. And how can we do that? Okay, number one, we recognize that crises affect an ordinary person's life. No? We all can go through crisis, and that it's okay to not be okay all the time. No? It's okay to feel anxious. It's okay to feel sad. There is nothing wrong with that. No? But what is important is we become aware of those emotions. We engage actively in healthy activities, especially those that you enjoy. Facts, no, knowing basic information minimize fear. No? If you are unsure of what happens, then you can freely talk with another person. Make use of skills that you already have to cope. No? Shift perspectives towards realistic optimism. And of course, words do matter. Let us all be generous in our praises, in our validations, no? Because words, comforting words, really matter in this difficult situation. How about for the family? How do we promote togetherness or wellness for the family? Number one, we still maintain routines and rituals. No, it's very important that you have one. No, you discuss family roles, responsibilities, and expectations. Do not just rely on one person to do everything. Make running the household a family affair. Add scheduled activities, including recreation. If possible, you can have daily calendar of activities, and of course, find opportunities for outside contacts. For example, I allow my children, no, to have their group. My son watches Netflix shows, no, together with his friends. No, I allow them to also play. No, I encourage them to have a chat, no, with their classmates, because that also promotes a sense of connection for them. No, so I allow them to enjoy their time with their friends, no, without me spying on them. Okay, they allow me to have time with my friends without them spying on me as well. No, so it's really a matter of enjoying each other's privacy. No matter how young they may be. No, but so long as you always have to emphasize that there should be corresponding responsibility to the privileges that they enjoy. Okay, other helpful materials that a parent, no, can actually ask their children to read are Breathe and Chill, which emphasizes techniques for relaxation techniques. Of course, COVID-19 parenting, which emphasizes building one-on-one time with each of your child and also your partner. No, keeping positive things. No, keeping it positive, meaning expressing what you feel through positive words rather than being very negative about things. No, structure up. No, I like what we'd always tell you. No, you have to have your own set of activities. No, call out bad behaviors if they do happen. No, but through it all, no, you try to keep calm and manage the stress. No, because keeping calm will also comfort the children as well. Okay, and do not be afraid to talk about COVID-19. No, there is another good book that you can try to download. It is doing what matters in times of stress. So it is one written by the World Health Organization, and it actually teaches us mindfulness. No, how do we enjoy the time to be in that particular moment? So this is a good read, no, for those who would like to have their own mindfulness activities. Okay. How about at the level of our organization? I am sure some of us have our own sets of friends, no? We are also workers, or we are responsible for others, no? A strong leadership and supportive teams influence the resilience of one's team, such that there should be a leader at every point in the organization, department, or even a team. Because once we set the tone for a positive and supportive organization, no, that's when resilience can improve. Okay? We can also have a proactive outreach and crisis support from all levels of leadership, and that, no, we need to also have role modeling, infection control, and safety practices. Okay, it all starts with our leader. There should also be delivery of clear, transparent, timely, and trustworthy information in a rapidly evolving situation. No, you have to remember, no, that for the time being, do you recall, especially when classes are about to start, no, there was a frequent adjustments in how we run things, no? So it's okay to have that, no? It's a matter of conveying to them, no, that these changes were actually done because uh, of also challenging times. Okay. Therefore, we also need to communicate efforts to address the negative impacts of the pandemic. No, for example, some may not be getting their increases in salaries, no, because of the certain cut down, because otherwise the school may not be able to pay for everyone. No, so those are some of the things that you have to really communicate well. No, communicate supportive organizational practices. For example, will we be allowing people to work from home, flexible work schedules, etc. No, and of course, no, we disseminate available self-care and wellness information and resources. Aside from that, training and education, no, especially on infection control, disaster mental health, and the disaster response is very important at this point in time. No, that is the reason why we are trying our best, no, to reach out to as many people as possible. And of course, no, let's not forget to provide creative and innovative ways to restore a sense of community and connectedness. No, for example, how do you do that? No, uh, I always recommend, no, for the school to actually hold an activity, no, a sole activity for the children to have meetings, no, or have virtual lunches together, no, because they also, I remember my son, ma'am, I miss my canteen, I miss the food, no, so instead of him missing that, no, so they can actually enjoy and look into what each of his classmates is actually also having for lunch, no, so they can have that as part of the curriculum. Okay, they can also build formal time during work hours for peer consultation, no, because remember during a time when you have face-to-face classes, children go, no, to the guidance counselors, no, but because the children cannot go to them, no, at least let them know that they have persons they can contact, no, should they need help. Okay, use in person or virtual service meetings and huddles to build relationships. And of course, no, you can also establish body system, not only for the students but at the level of the teachers as well, no, because definitely, no, in the workplace, no, any change, no, this pandemic has significantly caused a significant difficulty, no, for educators as well, no. Therefore, let's try to establish that body system, no, so that they can check each other from time to time. You can also you can, at the community level, no, what can we do? Okay, Public health should provide parents with knowledge about how children at different ages express distress and the importance of sharing and talking about fears and negative emotions. At least for private schools, they can have this. No, but how about for the public schools? No, I hope that eventually we will be able to reach out, no, even to other schools as well. No, they can also provide assistance to parents in handling online distance learning concerns, no, and educate people in the identification of the vulnerable population or those who are at risk for mental health concerns. And of course, no, we educate people to identify the red flags, no, when do we need additional support. Okay. So who are at the population at risk? Those with pre-existing mental disorders, no? Let's try to reach out more to them, no? You just imagine how difficult it is, no, for a parent of a kid with ADHD, no, or autism, no, to actually handle the kid alone, no? So you have to also ask them how they are, no, to provide more support. Those with anxiety disorders, no, if prior to the pandemic they are already anxious, what more in this particular situation, no? To those who will be badly affected by the pandemic, especially the healthcare workers, no? Why? Because the healthcare workers are actually the direct and indirect victims, no, in this situation. Indirect because they see the difficulties that their parents go through, no, and for every difficulty, no, they actually experience it as well, no, or they can even fall prey, no, to COVID-19 as well. Those who are unemployed, no, and casualized workforce who has to risk their limbs and lives every time they commute or they go to work, no, and of course those who are placed on quarantine, no. Most of my patients who have significant problems with anxiety have very difficult adjustments, no, in the quarantine, no. Why? Because not all of us can tolerate being alone, no. That is why quarantine is very scary for most of us. Okay. And let's be alert on the red flags, no, that may indicate increased stress. And what are those? Number one, a decline in one's ability or significant impairment to function. What, for example, if you notice that one coworker or one friend, no, is slowly having a difficult time, no, doing his tasks regularly, then that is a red flag. When you have symptoms that have become irrational or difficult to control, no, the worries persistently come to your mind, no, and preventing you from taking the necessary sleep, no, deterioration in a student's academic or work performance, and of course suicidal thoughts. If you have relatives, friends, no, or people you know who may have manifested any of these, no, then please encourage them to seek psychiatric support. Okay? In the end, no, let me remind you, no, that our efforts will always be highlighted, no, towards a particular part, no, of the pandemic where we think we are, no. For now, probably, no, we are reverberating between acute phase and the post-acute phase, no, such that our means to address mental health concerns should actually focus on these particular aspects. Okay? And at the end of the day, no, 2020, 2021 may not have been a very easy year for all of us, no. But remember, no, that it is also a time, no, that it made us realize the more important things. Okay, number one, that we realize that we have to take care of ourselves, because it is when we take care of ourselves that we will be able to take care of our families, our friends, our co-workers, no. So we have to prioritize self-care, no. We also have to realize, no, that our emotions, they are not bad, but rather they are part of what we're going through, and we should acknowledge them, no, and understand that what we are going through, no. And at the end, no, we will have to learn to be patient, no, to sit in this particularly difficult situation knowing that it will end. No? And let me close this night by saying to everyone that let us all remember everyone passes through a tunnel of darkness in life, a long tunnel that makes you think that you will never see light again, but there is no eternal love or eternal pain in the world. Thank you.